For our presentation, we are diagnosing the Phantom from the Phantom of the Opera musical with borderline personality disorder. The Phantom of the Opera is a movie that describes the life of a musical genius who resides under the Paris Opera House in the 1890s. As a young child, the Phantom was caged in a freak show, severely abused and mocked due to his deformed face. Shunned by the outside world, he takes on the frightening image of a ghost and takes advantage of the opera house and its owners, threatening to bring havoc upon them if they do not obey his desires. As the movie progresses, he falls in love with one of the main soprano singers, Christine. The Phantom displays many symptoms that stem from his abusive childhood when interacting with her. We diagnose Phantom with a borderline personality disorder. This disorder is shown through noticeable patterns of instability in interpersonal relationships and self-image. Paired with these instabilities is also marked impulsiveness and feelings of emptiness. With Phantom being shut in all of his life, he was never able to have a deep connection with anybody else and has always had a sense of emptiness. This is partly why he is so attached to Christine. Throughout the film, the Phantom obsesses over the character Christine. However, he has an unstable relationship with her. He demands that she stay with him instead of Raoul, Christine's lover, and when she acts out of line, Phantom curses her and exhibits intense anger and sadness. Right after the song I Remember, Christine takes off Phantom's mask and the Phantom becomes enraged and screams at her. Going along with this, the Phantom has frequent outbursts of anger in the film. He also expresses his anger in an inappropriate way. When Phantom's instructions are disobeyed concerning his opera, the Phantom responds by literally hanging a man. Also, he has fits of intense anger when dealing with Raoul. When Christine and Raoul finally leave together, the Phantom destroys all of his mirrors while screaming and crying. Considering all the symptoms for borderline personality disorder, the Phantom does not show signs of disassociation. Disassociation is described as a lack of connection in a person's thoughts, memories, and sense of identity. In short, daydreaming or getting lost in thought. Throughout the movie, the Phantom is thinking clearly about his intentions. In more developed forms of dissociation, loss of memory is common and people cannot recall significant parts of their lives. The Phantom shows no signs of this, or getting lost in thought, and in fact remembers everything involving his life. The main treatment used for borderline personality disorder is psychotherapy, or also known as talk therapy. The therapy that relates to Phantom and would help him the most is dialectical behavior therapy, or DBT. This is made to help teach the patient skills to control their intense emotions, help reduce destructive behaviors, and improve relationships. The Phantom could benefit from all of these, from random outbursts of negative emotion to him feeling the need to control Christine's life. Looking at the long-term outcomes, this can help reduce the symptoms present. This can, however, raise ethical concerns with hospitalizing patients without their consent, which can increase suicidal risks and thus become more dangerous for the patient's well-being. Therefore, it is important for the doctor evaluating the patient to think of the patient's best interest. The borderline personality disorder is accurately portrayed in the Phantom of the Opera. However, Phantom's case is extreme, as most people with the disorder probably do not haunt an opera house. Phantom does exhibit 5 of the symptoms listed in the DSM-V, however. Many films over-exaggerate and more commonly oversimplify a character's disorder into simple and few symptoms. For example, many shows and movies portray depressed characters as crying constantly.